So we're going to cover, we have the digestive system is broken up into two completely separate labs. You have digestion 1, which is similar to the respiratory system, where we're going to look at structure, function, all the way down from where food comes in and whatever you don't want goes right out, poops out. So, and along the way, some selective histology along the way. Some instructors do more, some do a little bit less. It depends on the campus. I wish we had an esophagus when we get to that, because it's easy to recognize. I like to be able to give you examples of easy histology, but unfortunately we don't have one. So we'll talk about that when we get there. All right, so just like in the respiratory system, we did structure, function all the way down. And these bodies on plate models are really excellent. This is one of our newer ones, and this is the other piece that came with it. Right, that gives you more detail of what's in the mouth. And then we have models on the side of the room that I'll make sure that you understand the relevance of it and how some of those will kind of go hand in hand with some of the histology. So here we have, we'll start at the oral cavity. You have the oral cavity, which includes the tongue, which has taste buds. You have a variety of teeth there. Exercise 4 in the lab that I've given you. We will look at the teeth, just basic components of the teeth, and we'll get some, provide some functions. But teeth are for mastication of food, for chewing of food. Right? And then the tongue moves the food around. The tongue, we won't get into all the functions of everything, but the tongue, works in digestion, help move food from one side of the teeth to the other. It contains taste buds. It helps with vocalization of speech, as you know. Right? You might just want to know, which cranial nerves convey taste from the tongue, facial nerve from the anterior 2/3 of the tongue, glossopharyngeal from the posterior third of the tongue. From the epiglottis, we have vagus. So taste, mastication, and deglutination is another word for swallowing. So that pushes the food back to the oropharynx, down into the laryngopharynx. And the epiglottis directs food into the muscular tube called the esophagus. So now we use peristalsis, which is that rhythmic contraction of circular muscles behind a bolus of food and longitudinal muscles distal to it to open the tube to push the food down, and that's what swallowing is. So the food is going to move through this tube of the esophagus down to the stomach. Between the esophagus and the stomach is your cardiac sphincter or esophageal, or technically lower esophageal sphincter, that regulates food from going from the esophagus into the stomach, but importantly from the acids, the acidic hydrochloric acid here, from regurgitating up into the esophagus so you don't produce erosions there. So we have the cardiac sphincter, we have the stomach. The folds are rugae that help increase surface area. Really what it is just a relaxed balloon. And when you eat food, it stretches it out, and then it collapses down, when it's empty. The sphincter to the inferior aspect, controlling the passage of chyme, which is the product of all the food and the hydrochloric acid and the digestive enzymes that have churned around here. It's called chyme. Will enter into the small intestine, more specifically duodenum, through the pyloric sphincter. Now, before we move away from the stomach, we need to identify the layers of the stomach. So the cookie sheet model is good for that. This gives you one great big mamma jamma stomach. We have the esophagus, cardiac sphincter, the stomach with their rugae, pyloric sphincter. Unlike other areas of the alimentary canal that has 2 layers of muscle, an inner circular and an outer longitudinal, the stomach has a deeper 3rd layer which runs at a 45-degree angle, so it's called the oblique. So when it comes to the stomach, you need to identify the oblique muscular layer, circular muscular layer, longitudinal muscular layer. And especially if you look out to the side here, you can see the fibers are going more vertically like this. So oblique, around, and more vertical. Oblique, circular, longitudinal. All right, so now we have, after the stomach and the pyloric sphincter, we have the small intestine. So this would be the small intestine here. We have 3 regions. The proximal end is called the duodenum. If I take this large intestine off, it's a little easier. Here's your duodenum. Then you have your jejunum, and you terminate with the ileum to the ileocecal valve here. And then that articulates with the large intestine. Along the way, you have accessory organs like the pancreas, the liver, and the gallbladder. The gallbladder, we have a biliary tree. We'll identify that in a minute. So following the alimentary canal, and we'll come back to the accessory organs, we have between the ileum and the large intestine is the ileocecal valve. At the inferior aspect of the colon, we have the cecum and the appendix. Then the large intestine is divided into regions. You have the ascending colon. Going across is the, if I can get it back together again. Come on, buddy. It's this way. Oh, whatever. Transverse colon, descending colon, sigmoid colon, kind of makes an S shape back toward your sacrum. And then vertically, you have the rectum with the external sphincter here. Okay, so if we go back now to our accessory organs, we have the pancreas. We know the pancreas is a dual function organ. In the endocrine system, we have our islets of Langerhans, or pancreatic islets, with alpha and beta cells producing insulin and glucagon. But the rest of it, and the majority of the pancreas, is producing digestive enzymes and bicarbonate, which all together are called like a pancreatic juice. But you do need to know what enzymes come from here, and that bicarbonate comes from here, especially for next week, because next week's lab is all about the chemistry of digestion. All right, so we have these acini or acinar cells that make all these different digestive enzymes and bicarbonate, and that passes through the white duct system here to merge with the biliary tree and enter the small intestine. Here you have the liver, 502 different functions. Bile is produced here. Bile passes through the biliary tree as the right and left hepatic ducts. They merge to form a common hepatic duct. Here we have our friend the gallbladder that stores and concentrates bile. The duct transporting bile away from that is a cystic duct. That meets your common hepatic duct to form a common bile duct. And that travels into pancreas to merge with the pancreatic duct at the hepatopancreatic ampulla. The ampulla is where these two merge and dilate. And then you have the hepatopancreatic sphincter, or the sphincter of Oddi, that constricts and relaxes to allow the fluids in these two tube systems to enter the small intestine. So the sphincter would be about this location. I'm trying to think of another organ. Well, this one here has a nice sphincter to it. All right. So this is a really good hepatopancreatic sphincter, a sphincter of Oddi. The ampulla, a little harder to see, but it's where those two join and kind of dilate so that the fluids don't entirely back up. And then hormones here in the small intestine will help relax that when necessary, and we'll talk about that next week. As a review, what you're also responsible for is this hepatic triad. So this goes back to, cardiovascular system, where we were talking about one blue, in this case purple, a red, and a green. The purple represents the hepatic portal vein, formed by the veins transporting deoxygenated blood from digestive organs, from the pancreas, spleen, stomach, small intestine, large intestine. We said those veins all merge to form a portal system here in the abdomen called the hepatic portal system. Hepatic portal vein, right? Hepatic artery. These two transport blood to the liver. And we'll look at the anatomy of the liver on the slide. This is the biliary tree. This is transporting bile away from the liver along the pathway described: common hepatic duct, cystic duct, common bile duct into the pancreas. This is how we're going to move bile salts, bile that emulsifies fats, how we eliminate all that conjugated bilirubin from worn out red blood cells. That's all going to pass this way into the digestive system, and then a lot of it, or most of it, about 80%, 90% is going to be eliminated in feces. So that's pretty much for this exercise, all the structures and functions. And let's look at some of the histology now. So we'll look at the small intestine. I usually choose either small intestine or stomach. Your instructor might do both. I'm going to show you the small intestine, the pancreas, again, for acinar cells, and we'll look at the liver for the first time to identify the anatomy there. This is the small intestine. I've moved to one end of the slide so you can kind of see all the different regions. This is the region that's closest to the lumen of the small intestine. So from about here all the way upward to the surface, that would be your mucosa. Then you have a submucosa area. Then you have your muscular layers. You have an inner circular, outer longitudinal muscle, and then to the outside you have your serosa, which is always some kind of stretchable, like an areolar connective tissue layer, for the, functioning the same way any outer connective tissue layer has been functioning. Right? So these here, those little extensions, that extend off the superior surface, those are the villi. Let me get the model as well. So the villi we looked at in immunology. This is where we saw these Peyer's patches and lacteals. All right. So here we have the model. Right. So these are the villi. Right? That's what you're looking at the superior aspect there. On the surface is simple columnar epithelium. In the lumen, you can't really distinguish, but we have, capillary beds, and we have lacteals. And then kind of spanning between the mucosa to the submucosa are Peyer's patches. Then we have the submucosa that contains areolar connective tissue, and of course you have glands, so you're going to have simple cuboidal epithelial tissue. You have an inner circular, outer longitudinal muscle, and then an outer connective tissue layer, that serosa layer. So when we look at them on the slide, I'm going to magnify a little bit. Up here are the villi, and you can somewhat see that simple columnar epithelium in that mucosal layer. So I'm going to magnify it so you can see the little goblet cells in between as well. Okay, so that gives you a pretty good view. So those little finger-like extensions, the villi, and farther down we have microvilli in the jejunum. Right, you can see these columnar cells here. Here you have some goblet cells in between. Through the lumen in here you would expect to find lacteals and capillary beds. Right? And they're a varying height, and because they're course in different directions, sometimes when you get a slide, you're just kind of looking at some of them on end because they're kind of pointing at you, but the other ones you can see right through the side of them. Right? So that's your simple columnar. This is where we take up those building blocks on the surface of these columnar cells. They become modified or sometimes just merely transported and exocytotically released here into the center to lacteals or the capillary beds. Fats will be modified by the smooth endoplasmic reticulum of those columnar cells, so that then when they release them, they go into the lacteals for transporting dietary fats. Right. So that's what you're looking at. Right. We'll move down to the submucosal region. And then you start to see, it kind of looks like, if you remember those models and slides we looked at for the dermis and skin in A&P1? It had that, kind of looks like steak. Everything reminds me of food right now, but yeah, it kind of looks like steak. That's your areolar connective tissue. And look, we have glands because we're secreting mucus onto the surface for it. Remember, mucus is a nice physical barrier to some, bacteria and viruses from getting across the membrane, but it helps lube the tube. So you're going to find simple cuboidal epithelium. Okay? This is your submucosa. Then we get into the muscular layers, and once we're magnifying even to this, and this is just low power, you can see the difference between your circular and longitudinal layers, especially like here. So your circular is generally the thickest region, which is going to be like this region all through here. This just broke apart when they cut it, right? So it's kind of going in this direction. You can see the long nuclei here. This is your outer longitudinal. Right? So the circular, keep calling it inner, quote unquote, inner circular, because it's closer to the lumen of the small intestine, is generally thicker. This gives you a really good idea too. From here to here is circular. Then you have outer longitudinal, which is generally thinner. And then you have, if someone pointed out here, and you start to see sometimes a little adipose tissue, that would be your serosa. Generally areolar connective tissue. And the functions are all the same. If it was, then this is smooth muscle, so it's under autonomic nervous system control. Outer connective tissue layer always secures the organ in its place, helps secure nerves and arteries and veins and lymphatics to the structure. Same function, that any other organ has had. So the small intestine isn't that difficult. The gastric slide would look a little different with gastric pits. And I'm going to switch to the pancreas. Again, back to the pancreas. Before we looked for the islets of Langerhans. It's a nice little one right here. Everything else, all these dark staining cells, these are the Yersinia or acinar cells that produce all the digestive enzymes that will pass through these duct systems to merge with the biliary tree and then use the hepatopancreatic sphincter of Oddi for entrance into the small intestine. So these cells make, your lipases, your nucleases like DNAs and RNAs, trypsin, chymotrypsin, carboxypeptidase, bicarbonate. You got to keep straight. The pancreas produces bicarbonate. The liver produces bile. Two different things. So that should be reviewed. The last we need to do is the liver, and the liver is somewhat new compared to the pancreas anyway. One's darker staining. Let's start here. Like many organs of the body, it is composed of repeating units. Like in compact bone, we had the osteons that were repeating structural and functional unit, of compact bone. Well, this is the liver. Right? And the liver is composed of these repeating lobules. So one lobule is kind of this hexagonal shaped structure. And they're all back to each other. You can see them repeating all over. I'll move the slide around. Within one lobule, which is the repeating unit of the liver, we have sinusoids, which are capillary-like structures that allow blood to pass through them from the hepatic artery and the hepatic portal vein. The walls of these sinusoids are lined by hepatocytes, so the cells will be hepatocytes. And blood will be kind of infused along the periphery of this lobule by the hepatic portal vein, the hepatic arteries, and the blood is transported and migrates to the center here, right, to the central vein. The central veins of all these lobules merge to form the hepatic vein then to the inferior vena cava. Right. So within a lobule, you have sinusoids, which are the passageways for blood, and they're lined by hepatocytes, and you have the central vein. Right. Between lobules is connective tissue and those portal triads. Now, it's kind of tricky to find a really good example of a hepatic portal vein, a hepatic artery, and a hepatic duct, but sometimes you can, and this might be one right up in here. Right. Even on scanning, this largest vessel that you'll ever see in these triads will always be the hepatic portal vein. And you can see red grainy goo in the lumen, which is telling you that it must be a blood vessel of some kind. Off to the sides here are going to be, hopefully, seen nicely, will be a hepatic artery and a hepatic duct. Remember, the hepatic artery generally stays kind of popped open. You can see a tunica media and maybe see some red grainy glue in the lumen, red grainy goo in the lumen, which would be blood. And ducts generally don't have any blood in them. Sometimes traumatically when they create a slide there will be, but it will be composed of a layer of simple cuboidal epithelium, and because there's no muscle, they often collapse on themselves. Right? So let me kind of scan around a little bit so you get the feeling of what these repeating lobules appear as. So you can see them repeat all over. And And then we're going to magnify. This is high power. All right. So let me go back. This is low power, and then I'm going to go up in magnification so you can kind of see it again, and then we'll go back again. All right. This will be your hepatic portal vein. If I remember correctly, this is going to be a little artery here, and that's going to be a duct. And there are a couple more scattered through here. I mean, you can look at them, and that's pretty much, you can anticipate that that's going to be a hepatic artery as well. And they are scattered all around the periphery. So you see pictures in lecture how the arteries and the veins kind of merge, and it's going to allow the blood to pass through these sinusoids. So these hepatocytes can extract whatever, the oxygen from the hepatic artery, but from the hepatic vein, all the nutrients from the end molecules that you just absorb from your digestive organs, and it starts to repackage them into other usable products such as like albumin, in the body. So let me magnify that so you can see, because you should be able to distinguish between the three on a slide for the exam. Okay, so this would be the hepatic portal vein. It's huge. They generally will be. They kind of look like a Grand Canyon compared to everything else. Here, right in the center, we have a little artery. Up here we have another little artery. That would be a duct. No muscular layer to it. Let me just move it a little so you can somewhat see. Okay. This is on high power, but I'm just letting you see kind of histologically the difference. Big hepatic portal vein. Here we have a hepatic artery. Up, I can't reach, but there we have a hepatic artery, and this is a duct. And you can see that that is definitely different tissue than what we find here. If we had a little bit of oil, we wanted to look at that, we'd probably confirm that that's simple cuboidal epithelial tissue. This is a lovely example of a portal triad. The portal triad, once you're within the liver, contains the hepatic portal vein, hepatic artery, and a bile duct. When you're in the liver, we call it a bile duct. Then the biliary tree follows the right and left hepatic ducts to a common hepatic duct, joins with a cystic duct to form a common bile duct into the pancreas. So I know they kind of change, but try to keep that straight, because depending on your instructor, they may be, very, very particular and precise about that, and they may not. It depends on the instructor. Sometimes they'll just maybe ask you, what is this entire structure called, and you could just call it, a hepatic triad. That would be fine. They might ask you, what is this specific vessel? This one, that one. Then you're going to have to specifically identify. They're not going to ask you about tunica interna, media externa, anything like that. It's just which one is which. Fair game would be the cells found in the lobule hepatocytes. What the whole structure is called the lobule. The vein in the center, the central vein. But that's pretty much it. So let me just go back to low power so you can kind of see where these are organized together. And now on low power, you can now kind of get a better view. Sometimes, low power, you end up seeing more. But that is the last of the liver slot. I get this little dude, but it's one. Oh, here, hold on. Stop for a second. Go. Okay. I generally forget to do this until later, which I did. This little model is great for distinguishing between the salivary glands of the mouth. We have a sublingual gland, a submandibular gland, and the parotid glands. They do have slightly different functions, but as a group, they're just salivary glands that secrete saliva that contains things like salivary amylase that initiates carbohydrate digestion in the mouth. But this is really good because the parotid gland is superficial to the masseter, to the temporomandibular joint of the TMJ. Sublingual means below the tongue. Submandibular means below the mandible. Now we still need to quickly look at teeth. So all of them are loose, and some are actually in a mandible. So if we wanted to point to these on this type of a model. These to the front that are flat are your incisors. Then you have a canine, 2 premolars followed by 3 molars. Functionally, incisors cut, canines shred or tear, premolars and molars. See the surface on that? It's much broader. They're grinders, right? They're grinders. So this is an example. Maybe look at these other mandibles with a full row of teeth on the on the mandible. We don't have too much that would be connecting to the maxilla, but we do have some large teeth here that are numbered to study from, and the cookie sheet model. Now there are 2 regions to the tooth. This is what I use because I don't get too much into teeth, but you have a crown and you have a root. The crown is generally the portion of the tooth that's above the gum line, and the majority is the white part that's enamel, that's very, very hard. Below that, in the root, is where we have blood vessels and nerves, as most people know. If you've ever had a toothache or had a tooth pulled or a cavity, these are where the nerves are and the blood vessels are. And we have ligaments, periodontal ligaments, connecting them to the socket, the tooth socket it sits in, and those sockets are called alveolar processes. And for those with really good memories, they will remember from A&P 1, this is a gomphosis joint. So for me, that's all you need to know. Crown, enamel, root, nerves and arteries and things below the gum line, above the gum line. But, so most of the questions come from the identification of the tooth, whether it's an incisor, a canine, a premolar, or a molar, and what its function would be. Okay, and I think that's it.